We've received an order from Dr. Guy to put a catheter in Mr. Rogers for fluid retention, urine retention. That I would confirm the order, make sure it's for today's date. See if there's any other orders that go with it, such as a UA or anything. Confirm his room number. I would wash my hands, gather my equipment. I would gather the catheter kit that would be in a plastic container, so you know it has not been any ways compromised, and also cloths to keep him clean, or to clean him while in the room. I would enter the room. Hi, Mr. Rogers. I am Sean. I'm your nurse for today. How are you? I have an order from Dr. Guy to place a catheter for that urine retention to release some of that pain. Yes. Can you tell me your name and date of birth? Do you have any allergies? Okay. I'd make sure we have all the privacy. If there's anyone in the room, asking them to leave, make sure that his curtains are closed in his room. Make sure the door is closed with the down and everything. Okay, we're gonna go ahead and get started if that's okay with you. Okay, I'm just gonna raise your bed a little bit so I'm not bending over so far, if that's okay. I'd raise the bed up to height. I would then get a new pair of gloves, put the gloves on with water and everything. We're gonna do some pericare, okay, sir? And we would do pericare around the area. While doing that, I would look for any skin lesions, any rashes, anything that might provide information to something else that we need to look at. After that's done, we're gonna dispose of that, dispose of my gloves. Okay, how have you been? Good. So now I've got my sterile kit on the bedstand next to it. I'm gonna ensure that everything's sterile around it. I currently do not have my gloves. I'm gonna open, always away from you, the kit. So I'm gonna place a sheet just right below you, just so we don't get anything on your bed. Is that okay? Okay, on the count of 3, we'll lift you up. 1, 2, 3. I get that under him as well as I could. And now we're gonna place a little curtain over you, just to sterile. Don't need to cause any infection or anything. I would assure that I get that on place. Now I am going to take and put on my sterile gloves, opening them away, assuring that I stay within my sterile field as I do so. As I put on my sterile gloves, I'm going to reach underneath the cuff. Sorry, I would not reach underneath the cuff. I would reach above the cuff and place my first glove on, making sure not to touch under the cuff. Under the cuff is sterile. On this one, as you place your second glove on, I would reach under the cuff, placing the glove on, assuring not to break the sterile field at all. And I found sometimes it's easier with my left hand first, sometimes my right hand. I would then take this and dispose of it outside my sterile field into the garbage. Sir, is it okay if I put these between your legs? Okay. I'd take my sterile field, place it between his legs if possible. I'm first going to check my tube, my balloon, to assure I have a good balloon. So, sir, what this is this is a balloon that's going to hold your catheter in place. Yep. We will deflate this before we remove it. Correct. Okay. And then I'm going to take and put my lube there for him. Put my iodine in. After I have iodine, sir, we're going to clean your privates for a little here. I'm going from top to bottom using a new cleaning one each time with the iodine. Once it is clean, I'm going to have hold of this with my non-dominant hand. This is not a sterile hand now. With my sterile hand, I'm going to take the catheter. I'm going to put it in, going in approximately anywhere between 1.5 and 3 inches, or till you get urine return. Once that is in place, I'm going to release this I'm going to inflate the balloon. Once the balloon is inflated, it is in place. I'll then remove. I will secure everything in place, secure it to his leg, dating it, timing it, initialing it when it was in place. If we needed a sample, I would then get a sample, labeling the sample, a name, date of birth, time of collections, and if he had an MSN number, a number for his stay or his client number, I would place that on there. A lot of times you'll have stickers when you go in the room to place that on. Once it is secured to his leg and everything, I will then remove everything from the patient, leaving the catheter in place on the bed. Okay, so I'm gonna have you lift up real quick and we'll get that out from underneath you. Are you feeling any relief? Okay, good. That's good. I'm going to lower the bed back down to its normal height. I am going to give him the call light. Sure, he knows the call light. I'm going to turn, wash my hands, get him repositioned in bed so he is comfortable. Make sure the catheter is hanging off of the bed where it is secured. And that I would document or orally, mentally document how much return I got initially when we did put the catheter in. Is there anything else I can get you, sir? Okay. I would cover him back up, make sure the doors or the windows open if he would like it, make sure he has his call light, the bed's in. If he has orders for side rails, I'd make sure they are up. Assuring he's okay. You don't need anything else, Mr. Rogers? Okay, thank you. I would now leave the room, wash my hands after leaving the room, outside the room, and then go to the nurse's station and document the procedure.